I am Ignaz Semmelweis, and I want to tell you a story about a maternity ward in Vienna, 1847, where women treated by doctors were dying of fever, at almost triple the rate of the ward run by midwives. Same hospital, same city. I, Ignaz Semmelweis, saw something, that the doctors were coming straight from autopsies to deliveries. Maybe the simple act of washing hands could help? I couldn't explain why it mattered. Germ theory was still 20 years away, but I made them wash their hands anyway. Mortality collapsed within months. I had the signal before the field had a framework to believe it. Today, DocAir unveils a framework to identify these signals and to implement the world's first operating system for pharma commercialization. It's called Daily Command. It runs on a proprietary AI model that they have named after me, Semmelweis. So why does pharma marketing need its own AI?
Every AI model reshaping marketing right now was trained on the open web, product reviews, travel blogs, the whole undifferentiated internet. It's also the worst possible foundation for an industry where the wrong inference isn't a bad recommendation. It is a compliance violation, or worse, a clinical one.
That's why Semmelweis does what no enterprise GPT model can replicate.
Reasons over the Espion identity graph of 6 million plus verified HCPs, clinical intent signals, patent triggers technology, 185 plus direct EHR integrations. So it understands where a physician sits within a treatment decision rather than inferring intent from demographics in a fully compliant process. In my words, to catch the signal through the noise. And in your words, this is what you said.
The first thing, though, is, believe it or not, the SLM has a lot of attitude.
So one of the things that one of my clients said to me this week was, we're the only ones that are going to look at this dashboard, so we have to build it for the marketers, but no one's ever going to open it.
Being so spread thin with bandwidth because we are so short-staffed, and this is on all sides of our business.
We're marketers suffering from an information problem, an insight problem, or an action problem, or all of the above.
We have a connectedness problem between those things, either between disciplines, between silos, between insights, between plans, between action, between measurement, and back again.
That's not a talent problem. Some of the sharpest people I have worked with in any industry are doing this work. We handed them a symphony and made them play it one instrument at a time.
We brought 75 senior leaders from brands, agencies, and data organization into a room in New York to design this, argue about it, name it.
And this is what you built.
This is Daily Command, the first operating system for pharma commercialization. Not a new tool in the stack, the thing that makes the whole stack answer to one command. It starts with a single command layer that understands clinical context, orchestrating awareness across every channel a brand uses, sequenced by relevance, not a media calendar's best guess. Clinical intent signals read real prescribing intent in real time, so the model knows where a physician actually sits inside a treatment decision, not a guess built from demographics. And every action it recommends is bounded on purpose. Semmelweis reasons over a verified identity graph of 6 million HCPs, our clinical intent signals, and over 180 direct EHR integrations, but it never touches patient data. Every recommendation is advisory, human-approved, and audit-ready by design. And for the first time, it doesn't stop at activation. The analytics workbench brings exposure, intent, identity, access, and outcome into one permissioned view. So measurement stops being a months-long report and becomes something a team can act on the same day.
The first question about a condition increasingly isn't typed into a search bar.
It's asked of a generative engine. Daily Command now connects natively to those surfaces, starting with OpenAI's ChatGPT and Anthropic's Claude, governed by the same identity spine and compliance guardrails as everything else.
One journey, every channel, one view of what work.
For years, Pharma Commercialization has been a collection of tools, pretending to be a strategy. Daily Command ends it.
We didn't build it alone. 75 of the industry's sharpest minds built it with us.
Daily Command is live today for pharma, agencies, and publishers across United States. Onboarding for Marketplace, Clinical Intent Signal opens now.
Make every signal count.